From KUNC and the NPR network, this is In The NoCo. I'm Erin O'Toole. Almost every woman will go through menopause in middle age. And that can mean symptoms like sleep disturbances, hot flashes and night sweats, mood changes, and brain fog. Drug companies have worked to ease those symptoms. But for more than 2 decades, warning labels discouraged women from using some hormone therapy treatments that contained estrogen, even if many doctors thought the products could help women during menopause. That changed back in November when FDA Commissioner Dr. Marty Makary announced the agency was doing away with the labels.
After 23 years of dogma, the FDA today is announcing that we are going to stop the fear machine, steering women away from this life-changing, even life-saving treatment.
A clinician at the University of Colorado Anschutz Medical Campus has unique insight into this topic. Genevieve Hoffman is a women's health nurse practitioner and a certified menopause clinician. And in a recent article published on the website The Conversation, she explored tangible ways that fewer restrictions on hormone therapy could make women's lives better and possibly longer. Genevieve joined me to discuss why she supports the new guidelines, especially at a time when many people are skeptical of the federal government's shifting stances on health policies like childhood immunization and nutrition. Genevieve, throughout the 1980s and 90s, many physicians prescribed hormone therapy that was effective in treating menopause-related symptoms. That changed after some researchers analyzed data from a large study that came out around 2000. Just briefly, how and why did that study change the way people thought about hormone therapy?
So this was a huge, big study that was a federally funded, randomized controlled trial that was actually a really well-designed study. As they were enrolling people and the study was going, the study was abruptly stopped because of this increase in breast cancer that was seen, as well as some what we call venothromboembolism or stroke and blood clot issues. And the way that this data was presented was very scary and wasn't necessarily an accurate reflection of really what that study was showing. But the abrupt stop of it, the announcement that was made, really put the fear in both people who were taking hormone therapy as well as people who were prescribing it.
What kind of health impacts did the fear around prescribing hormones create for women who might have benefited from hormone therapy but were not able to get it?
I mean, the quality of life piece, I think, is probably the biggest thing, right? You stop your hormones or you decide not to go on hormone therapy, which is really the gold standard treatment to manage the symptoms of menopause, specifically those hot flashing and night sweats. So you have a lot of really uncomfortable people who are walking around not feeling very good. Their sleep is impacted. Their cognitive function is affected. And with that, for a lot of people, probably came mood issues, anxiety, depression may have worsened. So you have this, generation of women who really missed out on some of the benefits.
Many women and healthcare experts have applauded this recent decision to remove the black box warning from all estrogen-related treatment products. But hormone therapy still does present some risks for some women. What concerns do you and other healthcare providers have about this recent decision?
So I think we have to remember that we're talking about two sort of different things. Localized vaginal estrogen, which is not systemically absorbed. The experts around menopause care and research have actually, for the last several years, been really trying to get the FDA to remove that black box warning from local vaginal estrogen because we know it's really, really safe. And so even in people who, say, have a history of breast cancer or maybe have cardiovascular disease, using local vaginal estrogen really can still be very safe to address the localized genitourinary symptoms that are associated. And then secondly, we're talking about systemic estrogen. This is estrogen that's absorbed into the body, into the bloodstream. And this is really more targeting hot flashing night sweats, that bone prevention. And the systemic estrogen still carries some of those risks. So the call for removing that black box warning has been in the works for several years, really focused around vaginal estrogen. What was surprising about this FDA sort of announcement was that they removed it from all estrogen products. And ultimately, I think it's a win for women and for the people who take care of them during menopause. But there is some concern that removing all of the labeling, even from systemic estrogen, paints this picture that it's completely benign. And it is benign for most people. It's a safe option for most people. But there's still some health risks associated with systemic hormone therapy.
Federal health officials have certainly issued some controversial guidelines recently around vaccinations and the new food pyramid. How trustworthy is this decision around estrogen labeling in light of other new policies that we've seen?
Yeah, I mean, I think it's a really good question. And I feel like it's important for people to understand that this recommendation has come from experts in the field. And there were a couple of physicians that were involved in the meeting, and they have been working for several years, like I said, to really delabel or take away this black box from systemic estrogen. So ultimately, I think it's a good decision and it's a win for us.
You've mentioned that hormone therapy isn't right for all patients. Just briefly, what other options are there?
Hormones are definitely the gold standard for managing menopause. But for people who can't take hormone therapy, say someone who's being actively treated for breast cancer, there are other non hormonal options. We've long used some of the SSRI type medications that are selective serotonin, medications that are used for anxiety and depression that actually have been shown to be impactful for things like hot flashing and mood disruption and sleep. We use other medications like gabapentin. And more recently, there are now 2 FDA approved treatments. These are non hormonal treatments for hot flashing and night sweats or the vasomotor symptoms.
Genevieve, it feels like there's been a shift in the way that people talk about menopause in the last few years. It was kind of taboo. And now you see celebrities like Drew Barrymore sharing their struggles on social media. There was a recent article in the Wall Street Journal that notes that women in the workplace are sharing how symptoms like insomnia or hot flashes affect them on the job. How do you see this growing public acceptance changing the conversation between patients and their healthcare providers?
Yeah, I mean, I think it's really important. And a lot of this stems from that big New York Times article that came out 2 or 3 years ago that was really looking at menopause. And I think the author of that said, we've long had a willingness to allow women to suffer, right? And so I think that that's really true. Ultimately, I think it's a really important shift and a really important change. We're acknowledging that this is a transition time, that it can be very impactful, and that we actually should manage it. And it's not something that just should be endured.
Genevieve Hoffman is a certified menopause clinician and a women's health nurse practitioner at CU Anschutz. She stresses that not every woman has a hard time with menopause, but that women who can benefit from estrogen treatment deserve access to it. It's important to talk to your doctor about the right treatment plan. We'll have a link to her article in our show notes and at KUNC.org. That's it today for In The NoCo. I'm Erin O'Toole. Thanks so much for listening.